Alright people, you're welcome to Insight with Ojoma Yusuf on Karma TV. You know how we do it in the studio. We try to reach out to every facet of life, reading out from the health sector, the educational sector, and then also the economic sector. But today we're hitting on the health. Why is the reason is just because we have to celebrate a specific aspect of the medical firm, and that should be the diabetic. 14th of November yearly is picked to celebrate World Diabetic Day, and that is why I'm doing that today. I also want to say kudos to every warrior out there. You've been struggling with it, and then also you've been trying, and then you've been trying to push up with this aspect of life. Don't just lose your hope, because I know there are better days ahead, and we all love you, and then we celebrate you. And I will not be doing this alone, because I don't have the key to answer all the questions, but I brought Dr. Tonde Elijah Garaga. Am I correct about that, sir? Yeah, I have to bring you all the way from FMC. The new name is Modibo Adama University of Technology, right?
University Teaching Hospital.
Okay, sorry, University Teaching Hospital. Yeah, I'm excited you made it to the show today, so you're welcome, sir.
Thank you very much. I'm glad to be here.
Alright, sir. And you know, I'm talking about diabetic and celebrating World Diabetic Day. I think we have to know more about the disease or the issue called diabetic, because I know so many people don't even understand. They just feel it's sugar sickness, and what does it entail? How do we get this, and then how does it happen to people, sir?
Thank you very much. Before I delve into what diabetes is, I just want to give a preamble with regards to the World Diabetic Day. The World Diabetic Day is celebrated every 14th day of November, and it's a creation of the International Diabetic Federation and the World Health Organization. It started in the year 1991, and then the United Nations by the year 2007 ratified it under Resolution 61/225 and adopted 14th November as the World Diabetes Day. It's a day specifically earmarked to create awareness and harness all advocacy efforts to bring to the awareness of the public and indeed policymakers the need to come up with policies and various strategies to curb the spreading of diabetes mellitus. In the last few decades, there has been an exponential increase in the number of people living with diabetes mellitus. Now on to the question of what is diabetes.
Yes, sir.
Diabetes is actually a chronic metabolic disorder in which the body is unable to produce a hormone called insulin, or the body does not respond to the hormone insulin. Whichever way, it results in diabetes mellitus. Now, in diabetes mellitus, it is characterized by persistently elevated blood glucose, because the insulin is a hormone that is produced by an organ in the body called pancreas, and the function of the insulin is to push glucose from the blood into the cells, especially muscle cells and fat cells, so that the glucose can be utilized to generate the much needed energy that will power cellular processes.
Wow. You know, as a layman now, all this explanation you made, I'll be like, whoa. Now, when we're talking about the body not being able to produce insulin, that insulin specifically, sir, I don't know if you can actually break it down for a layman that doesn't know what an insulin is all about.
Now, when we ingest food, the food we ingest, it is digested, and usually the glucose in it is liberated and then absorbed into the blood. The glucose cannot leave the blood and enter the cells of the body except with the aid of insulin. So insulin is a substance that the body produces that helps to ferry glucose across cell membrane, so that the glucose can get into the cells and the cells can now utilize it. So in patients that have diabetes, it is either the insulin is not being produced, or in certain instances, the insulin is there, but the cells are not responding to it. That is the hallmark of diabetes mellitus.
Wow. Okay, so there's this lingering question I know people are really asking, and I also want to ask you today is, can we say diabetic is an hereditary sickness? Like, can someone inherit diabetes? Even if on the normals, they just give birth to you on your own as a child, can you inherit diabetes from your parents or from siblings or something?
Thank you very much for that question. Yes, diabetes has hereditary component.
Okay.
In fact, if your parents are diabetic, then that particular individual is at an increased risk of developing diabetes, especially type 2 diabetes, which is the most common form of diabetes mellitus. So diabetes has a genetic component, and usually if one's parents are diabetic, his chances of developing it is much higher compared to another individual whose parents are not diabetic. Yes.
Wow. All right, people, you just heard this now directly from the doctor's mouth and not mine. Like, okay, I will go back to some questions, but then I'll let us go on a short break. So the next part you hear is the kind of food you should eat and the kind of food you shouldn't eat not to attract diabetes. So just wait shortly as we continue on the show. I'm still Ojoma Yusuf, and don't forget we've been talking about diabetes with Dr. Tonde from FMC, now known as Modibo Adama Teaching Hospital. All right, thank you so much. As we go on the show. Alright guys, welcome back to the show Insight with Ojoma Yusuf on Karma TV. Well, you know, we've been discussing on diabetic and also celebrating the World Diabetic Day, and then I've been here with the doctor from FMC. And you know, sir, this issue of what we eat and what we shouldn't eat is really hitting the fact. So I think so many people want to just want to get to know what are the kind of food that attracts diabetics to people and the kind of food we should avoid, or the kind of food you can eat to help a diabetic patient.
Right, thank you very much. Diet is an important component in terms of the management of people living with diabetes. And then, of course, for those that are not diabetic, also eating healthy will go a long way in preventing them from developing diabetes. Okay. Now, the kind of food that is recommended is a balanced diet.
Okay.
A balanced diet is a diet that contains all the 6 classes of food in their right proportion. Now, for instance, what is recommended for those that are living with diabetes mellitus? Yeah. It is recommended that the total caloric intake for the day, carbohydrates should constitute between 50 to 60% of it. Fat should constitute between 25 to 35. Protein should constitute between 20 to 30% of their total caloric intake. To a layman, this is difficult. And in our own setting, it's equally difficult. But what I would say is, as you grow old, once you hit the age of 40, there's the need for you to reduce the intake of high-calorie diets, things like table sugar, carbonated drinks, Coke, Fanta, energy drinks. There's a need for you to reduce them and increase the amount of vegetable that you take. And then, of course, engage in exercise. This will go a long way in reducing the risks of developing diabetes mellitus. For those that are already diabetic, there are food they can not eat at all. The no for them. Table sugar is a no. They cannot take table sugar. They can't take carbonated drinks like Coke, Fanta, and all of that. Juice, be it Chivita, Exotic.
It's out for them.
It's out for them. But however, what they can eat corn food, tuwo masara is allowed.
Really?
They can eat semovita. They can eat rice. They can eat yam. They can eat potato. They can eat be it Irish or sweet potato. They can eat it. But there's a caveat to that. They have to reduce the quantity. The quantity is what matters. They have to reduce the quantity. Now, there is this erroneous belief out there that once you are diabetic, the only food you can eat is acha.
Yes, I really wanted you to talk about that because
that is not right. You can eat the normal
rice,
the rice, and the rest. You reduce the quantity. Now, let me simplify it for the sake of the lay people. The quantity of the semovita or the tuwon shinkafa that you eat, it should be the size of your fist.
The size of the fist like this.
Yes, at most, you shouldn't go beyond 1.5. And then they should add plenty soup for you. If it is right, small quantity of rice, and then add vegetable to it. Once you do that, it will go a long way in actually helping in terms of ensuring that you have a good
Okay.
control of your blood glucose.
Okay. When you just mentioned that, we have this understanding already, like layman has understanding that you don't take, when you're already a diabetic patient, you don't take rice at all. If anybody seeing you eating rice, they're like, you're eating rice and you're told not to do so. Like, you don't take rice at all, you don't take so masara, you don't take corn, like, don't touch anything carbohydrate at all. That's how we all believe, or the myth that's just known everywhere. So I really want to appreciate you for making this clear. At least, okay, you're telling us that if you're taking this, you should make sure you take enough vegetable added to it and enough soup, so that at least it can complement whatever you're taking. All right, people, I think you've learned a lot. I don't think you should sit down without your pen and a book, because he's really dishing out things that are not free. I think if you need this fully, you're supposed to actually go and pay for consultation. But he's here for us for free today. So don't worry, we'll go on a short break and then we'll return back to continue on the issue on diabetes. Thank you so much. Alright, people, you're welcome back to the show, and don't forget, you can actually like our page, drop your comments, and also drop any advice you think you can just give us, so we can go further in the program. This is Insight with Ojoma Yusuf on Kama TV, and we've been talking on diabetic. We've been celebrating those already affected, and also we're giving the way out on how you can really avoid diabetes. Alright, sir, we've been talking since on this issue, and I want you to really advise those that are already diabetic patients. Yeah, I think you can throw some words to them and give them a word of advice. What should they do?
All right, thank you very much. For those already living with diabetes mellitus, lifestyle modification is very important.
Okay.
And lifestyle modification entails eating healthy,
Okay.
just as I've discussed what kind of food
Yeah.
they can eat and what they cannot eat. The emphasis on a balanced diet.
Yeah.
They should avoid normal table sugar, carbonated drinks,
Okay.
and then of course all this juice and the rest. And then of course in terms of fruits, they can take 1 or 2 oranges in a day, 1 or 2 banana, no watermelon, no pineapple. They can take cucumber, they can take apple,
Okay.
they can take garden egg. So that is for food. The next thing as part of lifestyle modification is exercise. The recommended regimen for exercise is 30 minutes of brisk walk daily.
Wow.
And whatever happens, you should ensure that you have at least 150 minutes of brisk walk in a week.
Okay.
So what that means is you cannot afford to rest for 2 consecutive days. So if you do exercise today and rest tomorrow, next tomorrow, you must go out for
You have
exercise.
to continue.
And it is very important for the exercise to be actually consistent.
Okay.
Then the other thing is there are certain habits that are not good,
Okay.
that one should desist from. Things like smoking, you should stop smoking.
Okay.
Alcohol, you should stop it. Then the other thing is if you are overweight or obese, you have to work on your weight reduction. So those are the components of lifestyle modification for people already living with diabetes mellitus. The second component of the treatment is usually the use of drugs, the
Okay.
so-called anti-diabetic agents. There are so many of them. Whichever one your doctor places you on, the
Work
key
on
thing
it.
there, you have to be adherent to it. You have to take your medicine regularly. Diabetes has no cure. It's a condition that can be managed. So treatment is for life.
Okay. Oh, that was a very good one. And then to those that are not diabetic patient, some people just feel I am not, so I can take as much as sugar I want in my system, and there's no problem about it. So what's your call to?
For those individuals, I want to sound this word of caution. Too much of everything is bad. There's a need for them to imbibe moderation, especially those that are up to 40 years. Once you're 40, you have to find a way of reducing your caloric intake,
Okay.
reducing the amount of carbonated drinks that you take, energy drinks and the rest. And then of course work on your weight, and then exercise regularly. Once you imbibe these measures, that will go a long way in significantly reducing the risks for the development of diabetes mellitus. Now, it is also important, if you are already at risk, for instance, if your parents are already diabetic, or
Yes.
any of your siblings is diabetic, then you have to go an extra mile and ensure that you carry out all these measures I've said,
So it doesn't
exercising, and then so that you also don't develop it. Because already, genetically, you're already
in line.
predisposed.
So to avoid it totally,
Yeah.
you just have to stay away from all this. All right, thank you so much, sir. I'm deeply grateful. Like, you sacrificed your time to be here. It's an honor and it's a privilege. So I say thank you for coming, sir. Thank you so much. People have been discussing with Dr. Tonde Elijah from FMC Yola. So thank you so much for coming, sir. We sincerely appreciate your coming and we look forward to bringing you back again to the studio.
Thank you very much. I'm
Thank
glad
you
to
so
be
much,
here.
sir. Alright, if we bye for now, this is all we can take on Insight. So bye. I'm Ojema Yusuf and thanks for joining us.